So in today's topic session, we will be discussing about the physical structures. Chapter on the physical structures of hospitals or healthcare systems. Those who have the textbook, you can mention the page number in the chat box. I don't have the textbook on me. Those who have the textbook, you can mention the page numbers in the chat box. So the quality standards for the prevention and control of infection, the key responsibilities for the prevention and control of infection, it comes from the top management as well, not just the people who have been hired for the prevention of infection, like ICM office, infection control officer, infection control nurse. Beyond that, even the top management is responsible. Okay, the resources that should be allocated from the top management when the budgeting is done, resources are allocated by the top management. The top priority of resource allocation is the high risk areas in the hospital. Okay, high risk areas in the hospital. And there are certain goals of infection control program. Usually it is the IPS, the goals, the international patient safety goals. There are 6 patient safety goals. Following those, okay, we'll also take care of the infection control program. Making sure that the medical equipment, devices, and supplies are in well functioning format. Okay. Sterilized properly, used properly. So that's about the medical equipment, devices, and supplies. Infection control waste, that is the biomedical waste. There will be a topic on biomedical waste management. So in that, you will learn about this in detail. Okay. So infection control waste, biomedical waste should also be taken care of properly. Okay. The disposition, segregation, transportation, and the final treatment of the biomedical waste should also be done properly. Then we have the construction risk. Page number 41 of quality management book. If at all a construction is ongoing in the hospital, in the healthcare facility, how you have to be aware of it, that it should not stop the regular functioning of the hospital. That comes under the construction risk. Situationally, the patients who are admitted in the pulmonary department, respiratory wards, those who have low SpO2 levels and all, okay, you have to be very careful with any construction that is taking place nearby these wards. Transmission of infections, standard operating procedure, transmission based precautions. Okay, standard transmission precautions and transmission based precautions. Wherever necessary, however necessary, it has to be used. Then you have the quality improvement program education. Quality improvement program education. on a regular basis, not just once, but on a regular basis. Repeated programs on the same topic should also be conducted. Okay, as a part of continuous nursing education, as a part of continuous medical education, these program and improvement methods should be trained for the staffs on a regular basis, for the new joinees as well as the old staff. Coming to the medical equipment, devices, and supplies. First is the levels of disinfection. There are mainly three levels of disinfection: low level, high level, and medium level, intermediate level. When it comes to low level disinfection, your soap, the basic soap that you use, okay, even the sodium hypochlorite, basic soaps that you use, surfactants that you use, they come under the low level disinfection. It can only destroy some bacteria, but not all bacteria, like mycobacterium and spores, bacteria that have spores, cannot be destroyed with low level disinfection. Okay, you need intermediate or high level disinfection for that. So on surface level, if you want to do the disinfection, low level disinfections is used. Environment surface, non-critical items, okay, which does not have any direct contact with the patients, okay, like bed rail, floor, blood pressure cuff, okay, in the sphygmomanometer. So for all those things, low level disinfection is okay. When it comes to intermediate level disinfection, it also destroys mycobacterium. It can also destroy some spores, not all spores. Okay, all spores cannot be destroyed by any form of disinfection. Okay. Some spores can be destroyed, not all. So non-critical items that can contact your intact skin, but not the mucous membrane. For that, intermediate level disinfection is used. For example, stethoscope. When doctors use a stethoscope, thermometers, ECG leads, okay? For all that, intermediate level disinfection has to be done. So what all things can you use for intermediate level disinfection? Alcohols, spirit, okay? Phenolic compounds, iodophores, sodium hypochlorite at an increased concentration, not the low concentration. Low concentration becomes low level disinfection. As you increase the concentration of sodium hypochlorite, that is bleach, the concentration level, when it increases, the level of disinfection also increases. Okay. Then you have the high level disinfection that will destroy all microorganisms. Most of the bacterial spores are also destroyed, but if you want to destroy all the bacterial spores, then sterilization is the best option. If in certain cases, in certain equipments, you can't do sterilization, in that cases, high level disinfection is used, because in high level disinfection as well, most of the bacterial spores are taken care of. It destroys all microorganisms except large number of bacterial spores, okay? Used for semi-critical items, devices that can contact your mucous membrane, like endoscope, respiratory therapy equipments, okay? They can contact your mucous membrane. So what are the agents used in high-level disinfection? 2% glutaraldehyde solution, 7.5% hydrogen peroxide, peracetic acid, ortho-fat aldehyde, and contact time is also kept for at least 20 to 30 minutes. The items should be in contact with the disinfectant. Only then it will work properly. Okay. So these are the three main levels of disinfection. Okay. Then you have sterilization. It's done in the CSST department, Central Sterile Supply Department. So the process is to make the medical instruments completely free of all microorganisms, including bacterial spores. Okay. And the role of CSSD here, it receives contaminated instruments from all the hospitals. It cleans the disinfectants, cleans, sterilizes, and stores the instrument. And whenever it is required, the CSSD will send the sterilized instrument to the user department. So when it comes to sterilization, again in sterilization, there are different steps. Okay, decontamination is the first step. Then inspection and assembly is the second step, because if any instrument is broken, if it requires a repair, it has to be repaired first and then sent for disinfection again. Packaging is done here. Okay, linen or non-woven wraps, rigid sterilization containers, peel pouches. There are different types of packaging done for the instruments that has to be sterilized. There are different methods of sterilization: steam sterilization, that is autoclave, ethylene oxide, ETO sterilization, then hydrogen peroxide plasma sterilization, hot air oven, dry heat sterilization. So these are the different types of sterilization used in hospitals. So there are different, from the quality control point of view, there are different indicators that we use in the CSSD to ensure that all the sterilization and disinfection that we have done, is it correct or is it proper? There are mechanical indicators, chemical indicators, biological indicators. All of this in detail we will discuss in the ICM class. Okay, that you will see all this. Just a second. So after this sterilization and cleaning and sterilization is done, the disinfection is done. After all these things, the sterile packs and sterile instruments must be stored properly to maintain the sterility. Okay, if it is moist, if it is broken, tampered, if it has fallen down and the peel has come off and the wrapping has come out, you do not have to use it again. It has to be sent for sterilization again. Don't use it, don't give it to the user departments. Okay. So when you are storing all these items after the processing is done, it should be in a clean, dry, dust-free area, well ventilated areas. Temperature and humidity also should be between 18 to 24 degrees Celsius. And relative humidity should also be around 35 to 70 percentage. Too much of humidity should not be there, because if there is too much of humidity, microbes will grow inside the sterilized instruments. Okay. Closed cabinets are preferred, not open shelves. If possible, go for closed cabinets. Protection: keep away from the windows and sinks. Do not store it under the pipeline. Avoid compression of the packs, because you don't have to spoil or damage the instruments inside. Otherwise, it can break the seal also. First in, first out should be the inventory rotation used for CSSD. Whichever instruments have come first for sterilization, those are the instruments that have to leave the CSSD first. Okay. Next is demolition and construction care. In hospitals or any healthcare facilities. So what happens here is when you do any demolition, any renovation or new construction work in the hospital, there is a very high chance, there is an increased risk of airborne infections, especially fungal infections, okay, like aspergillus and all. And physical hazard to the patient and the staff can also take place apart from this infection. So very strict infection prevention and safety protocol are necessary when demolition, construction, or even reconstruction is taking place in the hospital. Okay. Why this care is required? Because dust, debris from the construction they can also contain fungal spores. If it's a very old building and the walls were very close to any water body, any bathrooms and toilets, the walls will get moist. Okay, and in moist area, microbes, fungi will grow. And if you're demolishing those kind of walls and the paints are coming off, fungal spores will fly off in the air and it will cause more problem. Okay. So people who are immunocompromised patients who are there in the ICU, oncology department, transplant units, these are the people who are at very high risk. Okay. If a demolition is taking place. On top of that, physical hazards that are different. Okay. People falling down, construction workers falling down, electrical issues while breaking the wall or causing the demolition. Some major electric walls, electric wires and all got tampered. Noise, the vibration of this entire process. Okay, this can all impact your patient's safety and security and their rest also. Patients will not feel well rested if a construction is going around in the same vicinity. Okay. So there is a lot of risk assessment that you have to do when a construction is taking place. First is an infection control risk assessment that the ICM team will take care of it. Okay, they will do the engineering risk assessment before the work begins. They will identify what all risks are there for the patients in the areas that are affected and relocate the patients if it is required. Move all the high risk patients to a very far away zones away from the construction, and the schedule of work should also be done in such a way. All the major demolition should be done in the low traffic hours when possible, like before 10 o'clock, before 9 o'clock, after during the afternoon hours. Okay, between 12 to 4 and all, it is everyone will be in the office, so traffic is pretty much clear in the afternoon to noon times. Okay. So major demolition should be done in the low traffic hours in the hospital. And if there is a dust and airborne infection control, physical barriers should be used. Used sealed barriers, plastic sheet and dry wall should be used to prevent the dust from flying away. Okay, to separate the work zone and the patient areas. Self-closing doors should be there in the construction areas. Negative pressure room, if possible, has to be constructed to prevent dust migration. Okay, so that exhaust systems is there to push the dust out of the construction area. HEPA filtration should be used full on in all the high risk areas. Dust suppression should be done through wet mop, wet vacuum wet vacuum, that has to be done. Don't sweep the floors, because when you do the dry sweeping, the dust will fly away in the atmosphere back again. Okay, so wet mopping is required. Use water sprays to reduce the airborne dust during demolition. Traffic control has to be done. Separate areas should be there for workers, separate areas for the staff and the patients. Workers will enter the premises through a separate area. Sealed pathway should be done so that all the debris or everything that has been demolished, okay, those cement parts and big bricks and all should be taken away in a separate path, which is not used by the patients, visitors, and staff. Okay, and limit the movement of people around the construction area. Daily cleaning has to be done for the hospitals to prevent the deposition of dust. Always do the air sampling when a construction is going around. Air quality, air sampling test has to be done. Signage should be given for people because a demolition is going on, construction in progress, like that signage should be done. Noise and vibration control should be done so that at night no construction or demolition should be done. Okay, at night no construction or demolition should be done. Fire safety hazard prevention procedure should be followed. And after the construction is done, terminal cleaning and disinfection should be done of the entire area. Extra precautions has to be taken care of in the areas like PICU, NICU, hematology, oncology, transplant units, operating rooms. Okay, here extra care has to be taken care. Controlling the infections through transmission of air, that is airborne infection prevention. So a lot of methods can be used. Airborne transmission usually happens when the droplet nuclei, which has the pathogen, is less than 5 micrometer. Okay, or dust particles can also transmit the infection. Okay, diseases like TB, measles, varicella, some fungal infections. Okay, they all are transmitted through this way. So barrier precautions are used using mask, gloves, face shield, especially when the patients who are diagnosed with airborne transmission, give them mask, educate them to cover their mouth and nose while coughing, limit the patient movement. Okay, you can also create airborne infection isolation room, that is negative pressure rooms. Okay, in which exhaust system is given to push the air out of the room. Okay, filter it and then send it into the environment. Temporary negative pressure isolation room can be created if you don't already have the negative pressure rooms. If your hospital does not have airborne infection isolation room, then temporary negative pressure isolation room can be created. HEPA filter has to be done. HEPA filtration system has to be put in the positive pressure isolation rooms so that you can protect the people who are immunocompromised from getting any admission. So that's about the quality standards that you have to follow in about the physical structures. Okay, in a hospital, when it comes to the physical